Hello, everybody. Today we're going to talk about a subject that I'm very much in love with, and actually is the essence of my existence as a medical man, as a person who dedicates his life for more than 40, 45 years or more, helping people to fight and, if it's possible, at that time I was thinking, to eliminate the disease, which I was just trying to perform and try my best to really diminish and eliminate disease for years and years and years. Nothing happened. Yeah, people are feeling better for a little time, getting worse, but never substantially better. Now, at that point, I just realized that actually just fighting with any disease and trying to conquer that fight, it's not, it doesn't happen. So it needs something else. It needs a different approach. It needs a different, maybe not technique, but a different approach, maybe even technique, maybe even something. Anyway, I was not happy. It passed many years of disappointment. Not disappointed, that was not good. I was doing good. I love people, I love patients, I love the idea to help them. But I feel myself as a perfectionist or as a person who dedicate to really help honestly, to really be truly helpful to the patient. And I just put a question, am I really good enough to really help the patient? Am I really, I know enough and I'm really the one to really perform this kind of job, this kind of work to treat patients as a medical man, right? So years and years, I was fighting with myself. Now, at one point, I realized actually, I need to associate this disease with something else, maybe which I didn't know, maybe which I have to know. So at one point, it just came up in my mind. This disease is caused by something, but by what? What the disease is caused by? So I was looking left, I was looking right, looking everywhere, right? Now, of course, I was directed or limited by my specialty, right? The specialty itself limited me. So I tried to expand my knowledge in the left and right different specialty. And I really understand that actually any disease, it has to have some reason to be. Now, is a holistic man, right? Because I try always to think holistically, to look at the human being from different angles, not only for the anatomy, not only for the physiology, in anatomopathology or physiopathology, gotta be something more, something else, maybe something for which belong, or it has to be incorporated in my technique or in something else. And one day it clicked in my mind. This disease has to be caused by something else. So at that moment, I just associate any disease as an effect of a cause. So each time each time I just see a patient and they came with a defined diagnostic. That was the disease, right? I really defined that this disease is the effect of a cause. So at that point, I just established a concept, cause-effect relationship. So the cause is the cause, what really is the one that presides the disease, and the disease is the effect of that particular cause. Now, at that moment, my life as a medical man, no, as a health practitioner, it changed. My conscience of helping patients is really start being fulfilled. So I feel better that actually, no, I can do much more than I have done until then. So I associate any kind of disease, I just associate with their cause. So here I developed this concept, cause-effect relationship. Now, that, of course, took me a lot of time to find the causes of various disease. We're going to talk down the road about, we'll take a disease in a one by piece by piece. We'll take it, so we'll just, forgive me because I'm a little emotional when I talk about this. These are gigantic things. I believe that this one, hopefully there's doctors, various doctors will take a look here. They will change their perspective of looking not only the patient, of the disease which the patient of the disease that affect the patient. So everything will change. I'm fascinated. Really fascinated, because after I established this one, and after a while, every few months or every 1 year, I found the cause of different disease, So my professional success of treating patients has increased a lot, tremendously. I never advertised myself, and I was overwhelmed with the patient. Right now, too much. I work for too much, so then I pay the repercussion of working that much, right? So that's why now I just decide to retire, just to work very little to maintain my old patients and to be there for them. But I don't see new patients anyway. So this channel is not to advertise myself; it's actually to advertise this concept, to give this concept to anybody who really wants to know, who really wants to improve their help towards the patient, who really want to really fulfill their mission of helping the patient in much better way. So this is the concept called cause-effect relationship. Of course, I just include here the symptoms. So but I don't mention the symptom because really they don't matter. Doesn't matter. When you know the cause of disease and you address to the cause, disease is absolutely diminish or disappear, depend how early enough, how early that you find the cause, how well you can have access to the cause. Of course, at a younger age is much easier and much better. Older age, you still can help, of course, but might not be 100% as you can do with the younger people. So you see, that's I really am very happy with this one. Yes, I just said that there are symptoms, but symptoms derived from for the effect, for the disease. Now, of course, once you establish the cause, you address the cause, you correct the cause, or you eliminate much enough, then the disease itself sometimes disappears, sometimes diminish substantially. And the symptoms, if the disease diminish, the symptom diminish. If the disease disappear, the symptom disappear. Because see, nowadays the conventional way is just to fight the symptoms, which is good, is not bad, but it's absolutely not enough, because being under drugs for so long time, sometimes the body can get affected by this. So if you just try to find the cause and to localize the cause and address to the cause, disease diminish or disappear. So then, the drugs action, the drugs still are good, and I will never be against drugs. But probably you don't need to take so much, to use so much, so this way the side effect of the drugs diminish substantially. Yes, the medical science has developed wonderfully and very much, but rely too much on the medicine, which again, it's partially wrong. It's not bad, but it's not totally wrong either. But partially it's a little bit mistakes because the side effect. So my friends, again, this is the concept that I use in the past 30 years, I would say. It took me about 15 years to really get to this idea. So that I used for about 30 or 35 years, and I had tremendous success, and that's called the cause-effect relationship, because this is the relation. So and I didn't include here, but it's just understood the symptoms comes for the disease or for the effect, which is, it's a wonderful idea, it's wonderful things. So I hope whoever is suffering for a very long time about certain disease, just, of course, you rely on the fact that you take the medicine, which is, it's a good thing, so you cannot take it away. But try to see where the problem comes from. Look for that one, and look, and I'm sure that anybody can find that cause and address it and see what happened. I'm sure it's going to happen good stuff. Okay, my friends. So let's see you to the next video, where I'm going to talk about those causes, because the cause itself, because we can split the cause in two. I will tell you in next chapter, in the next video. Until then, I tell you, have a wonderful time and good day.